Hello, I'm Colonel Thomas Bunt, Commander Madigan Army Medical Center. I am accompanied here by Madigan's Acting Preventive Medicine Department Chief, Lieutenant Colonel Paul Festel. Dr. Festel, welcome. I have some questions based on at-risk groups and protection of those against COVID-19. There's some thought out there that children are at risk. What is your thought on these potential at-risk groups?
So for some reason, this condition is not as problematic in the pediatric population. They still can acquire this condition. We know that from our experience, but certainly for some reason they're having less complications related to this condition. We're closely monitoring that and certainly doing testing for those individuals who meet criteria, though.
Who meet the criteria. So if they're really not the potential at-risk groups, could you tell me a little bit about who you would consider a real at-risk group for this particular COVID-19 development?
Sure. So those individuals who have low immune systems, so immunosuppressed, those individuals with diabetes, chronic lung disease, chronic heart disease, those are the individuals that we're really most concerned about. Also using an age criteria right around 60 years of age or higher is the current CDC guidance to really think for at-risk criteria as well.
Well, that's good information to know because we, as you know, we have a large population of retirees here, and we want to make sure our retirees are protected and also that they're getting the latest information. What recommendations do you have for them in terms of websites to look at, information to pull? What sort of things would you guide them by?
Sure. The CDC website is a fantastic resource for information, further information. Madigan website is also a great information, great source for further guidance. We just left the medicine trainees this morning, and so we're teaching our residents in preparing for any potential for patients that if they come down with this condition.
You know, that's really good feedback, Dr. Festel. If I could, I'd like to ask you another question related a little bit to at-risk groups, but as far as social distancing, because some of those issues have come up as of late, and what that means is very difficult for us in our culture not to greet each other with a handshake or warm greeting. What are your thoughts on that going forward with COVID-19?
Right, and this is a fast evolving picture, and so it is kind of counterintuitive to not want to say hello and greet your colleagues, greet your friends and your family members. But at this point, the current recommendation is to really, be friendly. Say hello to those we work with and those we're friends with, but perhaps consider other means of saying hello. Things like using your elbows to say hello, perhaps, as a way moving forward as this thing progresses, and just being safe.
Right. We want to motivate folks and give them the thought that they can still greet each other and that they should greet each other, and I'd highly recommend that you do. Don't count the tiles on the floor. Look each other in the eye, give each other the greeting of the day, and ask them if you can help them if they need any help or assistance. We are, Madigan, we are here for you. And I think that's an important message to continue to send out.
Okay.
Thank you so much for your time today, Dr. Festel.
You're welcome.
And for all the work you're doing to protect our service members in our community.
Thank you.
Care with compassion.